Thank you. Thank you for being here. Actually, this topic I'm talking about today is a further topic, because the first topic I ever took on the AFRM was growth hormone, exactly the same topic, and this is already about 16 years ago. And since then, I'm personally on the treatment since 17 years. I never stopped growth hormone treatment. I never had one single second of regretting it. And half of my patients are on this treatment. This is probably one, if not the major treatment that you need to use in anti-aging practice. And as said, you can use it for adult growth hormone deficiency. Actually, this is the case for almost any other hormone you treat. I always advise you to treat only a deficiency, not when it's not necessary. But there's many information that shows it is necessary to treat with growth hormone, even if the lab test of the IGF-1, which is one of the major tests, are within reference ranges. And if people who have read my hormone handbook, on the back there's references that show that people are growth hormone deficient with IGF-1 levels within the reference range, low normal, or in the lower half of the reference range, can already be insufficient. So let's look a bit about growth hormone treatment of aging adult. This is the hormone handbook that you can purchase at UCP booth. And it's very practical to give you a lot of information. But what I mainly want to give you is the conviction that it is important, as soon as you spot, to treat growth hormone deficiency, because you'll go much further than you ever probably have been in treatments that have an age reversal effect and can attenuate a lot of age-related diseases, like cardiovascular diseases, but even the cancer rate decreased by about half in very severely growth hormone deficient adults when they receive growth hormone. So let's look a bit about the production. Here you see, this is the pituitary gland. This gland makes growth hormone for about 2 milligrams in a week time, so it's about 0.35 milligrams per 24-hour that the production is. We have if you're healthy, you have in your pituitary gland enough growth hormone for a week time. So any endocrine gland stores hormones in itself for you to use. And growth hormone is mainly produced at night. It's actually produced so that in the day you have enough of this major anabolic hormone. And in the pituitary gland, the major part there, anterior pituitary gland, has 35% to 45% of the cells that make, in adults, growth hormone. So it's therefore a significance. It's not only for kids growth hormone. And so the important is that it's probably the most, or if not one of the most potent hormone therapy. Actually, we know that IGF-1 and insulin can have an even greater effects on in anti-aging, on skin and muscle wasting. Growth hormone deficiency. How frequent is growth hormone deficiency? Well, actually, after the age of about 30, 31, there's in almost everybody a lower level of growth hormone activity in their body than there was at age 25 or 20 years, for example. So this is one of the soonest the hormone deficiency that appears and that gives already problems, complaints, physical signs, and also more risk of disease. So this is the nighttime serum growth hormone. Growth hormone is mainly secreted at night. More than 75% of growth hormone is secreted in a peak that is about the 2.5 first hours of your sleep. And this peak secretion at nighttime, when it's measured in hospitals, you see that it declines from age 31 years on. And it declines quite quickly. So take a person like me, who's 54, you see that I'm normally at about half of the production I'm able to do at night of growth hormone. So I'm already, in some studies, considered like an elderly person. I don't look elderly because well, maybe a little bit, but, but because I'm taking growth hormone since 17 years. This is probably the major reason of why I could somewhere calm down the aging. Growth hormone will stimulate the secretion of a hormone called insulin-like growth factor 1. And the levels of this insulin growth factor 1 reflect quite well the levels of growth hormone activity. If there's a lot of IGF-1, there's normally enough growth hormone to stimulate the liver to produce more IGF-1. And this level also decreases with age slowly, a little more slowly than growth hormone itself. So lower levels of IGF-1 within the lower half of the laboratory reference range in adults that are above age 30, for example, often reflect already a mild growth hormone deficiency. And there are now studies, and many studies, just not one study, there's several tens of studies that show that you better not be in the lower half or the lower third or the lower quartile, lower 25% of the values that can be found in a population of growth hormone of your age. So when you look at the decrease with age of IGF-1 levels, we can split this decrease that slowly occurs in age into lower quartiles. When you have a study, for example, that shows levels of IGN with lower quartiles, generally it corresponds to a bit the values in the upper range here of younger people. If you're in the upper quartile, if you're in the lower quartile, you have values that correspond to people between age 65 and 95. And we see that actually at these lower levels, as the lower 3 quartiles of levels, many studies show now that there's increased risk of disease, meaning that you already have some sort of growth hormone deficiency or IGF-1 deficiency. To have, for example, optimal healthy arteries, to have no atherosclerosis, you better be in this upper quartile of values. Values that are typical values of very healthy young adults. And you see that lower levels in the lower 3 quartiles show increasingly a bigger thickness, a larger thickness of the intima media, the inner layer of the common carotid arteries, that is typical for premature atherosclerosis. Also for obesity, the lower you are in the IGF-1 levels, the more risk you have to have a high body mass index and obesity in general. Also, the more risk you have of the most dangerous fat accumulation in your body, which is in the abdomen, the visceral fat mass. Also, you are more likely to have metabolic syndrome features, and you can be well within the reference range and still be not at a good value. Studies show that you better be in the upper 25% to have the healthiest value. So people with thin skin, thin muscle, typical expression of low IGF-1 and low growth hormone are at risk of having more diseases because they usually have lower IGF-1 levels. Also, you see that when you're in the lower 3 quartiles of levels, you have more mortality for if you have a disease like renal cancer or hemodialysis, you're a kidney failure patient and you're on hemodialysis, or you're a chronic heart failure patient. So you better not be in the lower 3 quartiles. So you seem to be good only if you're borderline high in IGF-1, meaning that you're quite high growth hormone levels. So the growth hormone may not be too low. So how do you detect a growth hormone deficiency? Well, first of all, growth hormone deficiency, you see it on people. Once you know, you can see it. I've written an atlas of endocrinology where you have a lot of hormone deficient excesses, but it's the most extensive part, because I think it's probably the major part, is on growth hormone and IGF-1 deficiency. You have the most pictures. There's a lot of signs typical. For example, this person, 50 years, thinning of hair. The hair is thinner. There's a thinning of eyebrows, very typical, the thinning of eyebrows. The droopy eyelids, for example. Everything actually when your growth hormone deficient starts to atrophy or to sag or to loosen. So the deep wrinkles, the sagging cheeks, very typical for growth hormone. I made a study very long time ago, it was in 1995, I believe, when I was starting to treat with growth hormone treatment. Actually, and the sign, physical sign, that was the best reversed or improved with growth hormone was actually the sagging cheeks. More than 71% of patients after 2 or 3 months said my cheeks are firmer than they were before. Also here, typical, you see also the thinning of hair, thinning of eyebrows, the droopy eyelids, the sagging cheeks. The face has to be firm. You have no healthy patient that has a face that is not firm. You can try, and you can believe the patient can say he's happy, but that's a typical sign of growth hormone IGF-1 deficiency and somewhere also testosterone deficiency. So it's not healthy. We have to try to reverse aging as much as possible in our patients. We shouldn't be satisfied that they look their age or they look 5 or 10 years younger if they're quite old. We have now the tools to go further in a safe way. It's actually very much safer to have your patient getting younger look, because younger look means also that inner part is also better if you treated this patient with hormones. So also the thinning of eyebrows here, very atrophied here. The nose thinning, and the nose is also a little droopy here, nose dip drop, and there's atrophic jaw bones. So everything can atrophy, and you can't reverse this. Sometimes we have, with mesotherapy, small little injections, have to put locally some growth hormone or IGF-1 to reverse it better on some local places. But you don't need to do many sessions to have important age reversal effect. So here's growth hormone deficient person. Typically, they have shoulder muscle atrophy, they have abdominal obesity, and there can be a pseudo-gynecomastia. There is with fat accumulation on the breast. There's fat accumulation in the belly and on the breast. And there's also buttock muscle atrophy. There's penis and testicle atrophy. The prepucium, because of too loose membrane around the glans penis, for example, and they have a thigh muscle atrophy. Other signs can be accumulation of fat can be sometimes quite severe, but very typically you need to have somewhere growth hormone deficiency to have a flabby belly. Otherwise, you accumulate the fat, but it doesn't have this sort of hanging effect that you can find. Also, very typically is this sort of kyphosis with very tense muscles. Growth hormone is a hormone that calms down the muscles of the shoulders. And the muscles in general. It's a hormone that stimulates the parasympathetic nervous system. And so people who have growth hormone deficiency typically have a bowed back that gets straighter with growth hormone treatment. And typically they breathe also deeper because they have a better attitude that spontaneously appears. They don't need to do an effort for that. And typically the feet can always be flatter. At age 31, I started growth hormone deficiency. I only treat myself at age 38. But during all that time, when I walked for long periods, I needed to put foot soles in because my feet were sagging. And when I was on growth hormone, I can stand for 6 days, 10 days, 10 hours on a seminar. And I've done one lately 2 weeks ago, and I have no pain in my shoes, although my shoes are rather flat shoes. So the foot arch is better with growth hormone. Typically you have sharp ridges with growth hormone deficiency because the skin atrophies, become less elastic. This is a hormone that makes the body firmer. And when it's not enough for growth hormone in pregnancy, for example, women can have easier stretch marks. It's a deficiency in relaxin, but it's also a deficiency in growth hormone. So when you pinch the skin fold, typically, it has to come back in 1 or 2 seconds. In children, 1 second. In young adults, 2 seconds. But when it's more than that, the skin is not elastic enough. And when it's more than 4 seconds, you're really in a bad position. There's not enough elastic tissue. And that's typical, a prolonged skin fold, more than 2 seconds after pinching the skin is a mark of growth hormone deficiency. Also sagging inner thighs, inner sides of the thighs improve generally with growth hormone treatments. So that it's likely to be a growth hormone deficiency symptoms. Sign. Also the thinning of the skin typically. When patients have too much growth hormone, they produce too much growth hormone in acromegaly, for example, the skin becomes too thick, like an elephant skin. But the opposite is also true when they have deficiency. The skin gets thinner and thinner. So what are the growth hormone deficiency symptoms? In a study I did a long time ago, typically they had the same symptoms, the growth hormone deficient adults had the same symptoms than children who have severe growth hormone deficiency. And so I took a study based on children where they reported the psychological complaints that these have or symptoms. And we saw that these excessive emotions were in most of the majority of the growth hormone deficient patients too. Sharp verbal retorts, permanent fatigue, and typically is the fatigue due to growth hormone deficiency is not a normal fatigue. You never recover anymore in your life when you're growth hormone. You can sleep 14 hours on a row and still do not feel as fresh as you were at your 25th year of age, for example. And you should. If you're healthy, you should feel as fit or almost as fit as at age 25 and not far from. Sharp verbal retorts. Remember, growth hormone is a hormone that stimulates the parasympathetic nervous system. So if you don't have enough, you get too much adrenaline or norepinephrine. And you get nervous. And you react quite quickly to any remark in a sort of adrenaline outburst. They also have, for this reason, more anxiety, and this is an anxiety without any reason. It's always a little bit there, this anxiety. When I stop my growth hormone for 2 days, for example, then I get already a little anxious. When I take it again, I lose this anxiety. It's an anxiety without any reason. And it has been shown for this anxiety that actually growth hormone is the hormone of people with severe anxiety, like social phobias and all sorts of phobias. They usually have much lower growth hormone levels or IGF-1 levels. You see here that these were patients who had complaints, and they had low IGF-1 levels, but some had within the reference range. So it's not all patients below. Even the majority were well within the reference range, but low normal IGF-1 levels. And you see that they have, as complaints, most of them had permanent fatigue, easily exhaustion after physical activity. They were not sufficiently aggressive. They could not defend their territorium in a certain sense, and they had a low self-esteem and some depression. And typically, if they stayed up, they passed their normal bedtime, they felt exhausted for 2 or 3 days. They went too late to bed. And so these are typical things that come up, and we'll see later what growth hormone does to improve them. And you see that patients with severe chronic fatigue syndrome, they have about 40% lower IGF-1 levels, and they have about half of the nocturnal growth hormone secretion than others have. So this is probably too low, and that gives this fatigue due to growth hormone deficiency. So we see there's a low self-esteem, very typically. 50% of those were complaining of that, and also a low sociability. When you're overwhelmed by growth hormone deficiency, you're overwhelmed by the world and its problems. It's too much for you. Everything is too much, so you prefer staying at home sheltered. You don't want to go in the evening to a party, for example, because it's too much for you. It overwhelms you. So there's a tendency to social isolation in about half of these patients that is very clear. And you see in depression, for example, in red are severely depressed persons and men. They have about less than half of the 24-hour growth hormone secretion. They have less of the sleep-related growth hormone deficiency, and the growth hormone releasing hormone stimulated. When you stimulate a growth hormone secretion by growth hormone releasing hormone, there's less than half that is output. So no wonder they're depressed. And how do you imagine that they will get out of the depression with psychotherapy? It's almost impossible for these. So we give those marks that they have endogenous depression, where you can almost not do nothing about. You can give antidepressants, but you will be not so successful as long as you do not provide the growth hormone. It's almost impossible, if your other hormones are more or less okay and you correct the growth hormone deficiency, to be depressed anymore again. Because you see, growth hormone is a hormone that seems to make you relativize your problems. You see what's very important in your life and what's less important. And so not everything is a problem. So it helps you to see clearly and in a certain sense to have less problems because you felt more assured. It's also a hormone that seems to boost your capacity to find solutions to problems. And typically, when I was on growth hormone for several months, a patient said, "Doctor, I do not understand how you can do that." And actually, I didn't remark that myself, but I was talking to the patient, very concentrated. I typed some things on my computer. I had to open the door. I had a special button for it. The secretary came in, asked me a question I could answer, and the phone in between also came up. I could answer, and I felt very comfortable to doing all these things without losing my concentration. That is typical for growth hormone. The hormone where you can do multiple tasking at the same time without many problems of concentration. So you have poor resistance to stress in quite a lot of patients, more than 90%. You have tendency to socialize in about 50%, and they also feel very typically powerless. They are not able to cope with the situation. They have this sense of powerlessness. Everything is too much. So that's also one of the reasons why they have a low self-esteem. So you have insufficient aggressive sense of powerlessness. The world is too much for them. So growth hormone deficiency, the best lab test actually for growth hormone deficiency is the plasma IGF-1 test with and always with, don't do it without, IGF-BP3. And that's a little problem with this test. In most labs of the States, is that most labs in the States and elsewhere in the world do it with chemoluminescence. It's a technique that does not require to possess a radioactive lab and to have specialized technicians. But the problem is that the IGF-1 then once is half of what you expected, once double that you expected, it doesn't seem to be very reliable. You need to have a test that is done by radioimmunoassay. As long as you don't have it, you won't fit. There's another test for hormone tests where you absolutely need to have radioimmunoassay, or you also have more than double or triple the values you expect, is testosterone in women. That test absolutely needs also to be radioimmunoassay. So IGF-1 levels have to be determined, and also the IGF-BP3. And if it is expressed in micrograms per liter, what you have is that the IGF-BP3 should be about 10 times as much as the IGF-1 and IGF in men and women. IGF-1 in men is slightly higher than in women, 300 to 350 micrograms per liter. That explains why they have thicker muscles in general and a thicker skin. And women a little bit lower. And those values are okay. You should not be borderline low in the reference range, because we saw that that is already linked to more pathology, more risk of pathology. So this ratio should be, if this is 1, this should be 10. If you have a too high IGF-BP3 level, this means that the patient is actually keeping the IGF-1, which will express much of the activity of growth hormone, will remain in blood and not go in the cells. This is valid for any other hormones. If there's too much transporting proteins in blood for that hormone, you do not have much getting inside of the cells. It remains linked to the binding protein. So you could have IGF-1 levels and IGF-BP3 levels within reference range and still have deficiency, because IGF-1 is rather low and IGF-BP3 is rather high, for example. And you will see that they have physical signs of deficiency and complaints of deficiency. There's a study of Hartman that showed that patients that have an IGF-1 below the 84 micrograms per liter, which is generally within the reference range of patients between 60 and over 60 years of age, but is not a good value, because at that value you generally can't, you don't need almost an additional test, because that's considered as much too low and as being growth hormone deficiency. That's one of the ways of staying, but this is actually severe growth hormone deficiency, not the milder forms we also are talking about in this lecture. And so you can also make a diagnosis in 24-hour urine. There is a growth hormone test that is valid for 8 patients on 10, not for any patient. Some patients have high levels, although they don't feel so good. So there's in some patients a loss of growth hormone in the urines, and so it's not reliable in about 20% of patients. So how do you treat with growth hormone deficiency? Well, first of all, you should supply injections. There are sublingual forms, there are stimulating amino acids and things like that, but it doesn't work as well as supplying the hormone at the optimal dose. Always works better. So this is really the optimal treatment. And subcutaneous injections are okay. I say it's okay because if you give an intramuscular injection, you mimic the circadian rhythm better if you do it before bedtime with a more acute peak of values of growth hormone, because there's more blood supply in the muscles, so you get a better absorption of the growth hormone in the muscles than in the skin. But still, the results is that in the skin, it's very fair as an effect, and it's better to do it there so you don't damage any muscles. If you constantly inject the muscles, we have seen this with insulin injections, it damages the muscles. So it's safe to do it subcutaneous tissue. And how do you do it? You should not pinch the skin. Please do not make your patients pinch the skin. Otherwise you get blue spots, hematomas. You should extend the skin, the 2 fingers apart, so the skin gets a little thinner, and then you go oblique-wise inside, so you remain in subcutaneous tissue. The best in patients who are a little sensitive to injections is to always use another needle, a new needle. If you have an injection pen, a new needle on it. I do it a little different. I'm so sensitive to growth hormone, I need to give a diluted form of growth hormone. And I dilute it, so I need syringes. I need to vial where I put it. I need syringes. And I inject myself with syringes, and I put enough quantity for 3 days, 3 or 4 days. So I reuse the needle the syringe that I've left in the fridge with a remaining amount of growth hormone, enough for 2 or 3 days. So each time I take a little quantity. So I'm a little lazy, and I don't want to always take out the vial and recharge a new syringe. But most patients who are sensitive to needles need to use a new syringe or a new needle on the injection pen each time. When you inject growth hormone, this is the typical circadian rhythm of growth hormone. You see almost no secretion in men during the day, but there's then a very peak secretion in the first 2.5 to 3 hours of the sleep. And so to mimic that, you just inject it before bedtime. It's the best way, because there are probably more receptors for growth hormone at night than during the day. Growth hormone is also a hormone that can improve your sleep. The deep sleep is better with growth hormone, and the rapid eye movement phase is also longer and more intense. So it's actually probably will also, by doing this, you will sleep also better. It also relaxes your muscles, so that also is known to make, if you're better relaxed, you fall asleep easier. So how frequent should you do injections? Well, every day. And once a day is generally sufficient. Some patients may benefit from doing it twice a day, a third in the morning, 2/3 before bedtime. Very rarely are some people who do not sleep well when they take growth hormone before bedtime. I have 2 patients like that. They need to take it in the morning then. But most will do better by doing it at nighttime. So before bedtime. Where do you inject? You inject on the belly and on the outer part of the thighs, external part. You need to change place all the time. If you inject on the same place all the time, you will have hypertrophy of the tissue locally. And if you inject always on the same point, I had a patient doing that, you have a hole. You have really a hole. Very impressive. I had a patient who did that, and he was very happy. He said, this shows the fat-reducing effect of growth hormone. I hoped he recovers from that. He didn't complain afterwards, so I probably didn't look. Was a little afraid of looking. Again. So doses for an adult. First you need to know that sometimes it's expressed in international units, sometimes in milligrams. Now the new way of expressing is in milligrams. And 1 milligram is 3 units. 0.1 milligram is 0.3 international units. So that gives you an idea of what the dose should be. We see that the daily production is 0.35 milligrams per 24. So somewhere you should inject, depending on the severity of the deficiency, from 0 to 3.5 milligrams. So what we see is that for most patients it is generally sufficient to get almost all of the psychological benefits with doses that are around the 0.1 milligram. So you don't need so much. It doesn't need to be so expensive. The price of 0.1 milligram is something like $4 a day. So the average dose for clear physical improvement is generally when a person is really aging and you want to reverse that aging, you need doses from 0.15 milligrams or more. So you need higher doses generally than 0.1 milligram. And we have some patients who do not improve their muscles and their skin with growth hormone, although they have clearly growth hormone deficiency. That's because they have other deficiencies. They usually have low insulin, and the IGF-1 also is too low. They are not able with their growth hormone to make enough IGF-1. At age 52, I started being tired and had no reason. I was, let's say, optimally treated. That's what I thought. And then at that moment, I saw that my IGF-1 levels didn't get up as well with growth hormone. And that's the case for most people. After age 50, they are not able to make with growth hormone enough IGF-1 to get the full effects. So you need also to add additionally IGF-1 to be optimal healthy. And I see more and more, because I talk about IGF-1 in many different countries, I see that in the countries where it's not available, to get it available. I was in Brazil, I would say 2 months ago, they didn't have IGF-1, now they have it. There were, one of the pharmacists that is here showed me that he even has a package to do the mesotherapy I proposed with growth hormone and IGF-1. So they have it now. It's only the scare of the compounding pharmacies here and the sort of refusal of the firm of IGF-1 to give it for adults, they only want to reserve it for kids, that it's making a problem. But legally, you can give IGF-1 for IGF-1 deficiency, which can be clearly shown. That's one of the reasons I put so many references in my hormone handbook. It's to protect you from medical boards and from legal issues. Because you have studies that show that if you treat low IGF-1 levels within reference ranges, you are already deficient because you are at higher risk of dying of disease. So that's a medical justification that shows that there's deficiency. Never ever for hormone has it been shown and proved that if you're below the lower reference limit, you are deficient and you're above your K. The reference ranges are statistical reference ranges. It's always so that for your age category, 95% of the patients will be within the borders and 2.5% below and 2.5% above the range. So it's not a definition of health or hormone deficient or not. It just shows you statistically where other people are of your same age group. So the growth hormone once a day, injected under the skin. You have to change injection site and you have to keep the material in the refrigerator. And on days of severe stress, a supplementary dose can be given. If you're getting too anxious, you can take some more. You should lower your thyroid hormones and increase growth hormone. Why lower the thyroid hormones? Because growth hormone speeds up the conversion of T4 to T3, so it somewhat speeds up thyroid activity. For one day, there's no problem. But if you would, for chronically use, you have a very stressful period for 4 days, for example, then it will start increasing too much the conversion of T4 to T3. You also need to lower a little bit the thyroid hormones if your patient is on thyroid hormones. So there's pens, many different brands. The one click shows you that You don't see the needle, so people are afraid of needles. They don't see it. It's easier. And although you have the genotropin and the norditropin, quite easy. And the omnitrop is in the world cheapest and one of the best. So, but I don't think you have that so easily here. So the best you have, I think, is norditropin. But all these like genotropin, the mini quick, that's just a little syringe where it's filled up with a powder and a liquid, and you mix the two at the moment you're going to inject. And these are the typical insulin subcutaneous syringes that are used also for growth hormone when you use a vial. Of course, the pens are much easier, and generally the needles are thinner. So it's very it's pleasant, actually. It's not unpleasant. All the other growth hormone secretagogues do not have the same effects. They do work in patients below age 35. They do not seem to be very helpful after age 40. The secretopin is probably one of the best of that, but it still doesn't match 100% as well as the growth hormone. So when you have a patient above 40, 45, you generally have to give the growth hormone, because if there's not enough growth hormone, there's atherosclerosis. Of course, now with the modern techniques, with many other hormones, we are able to more reverse aging, so you can wait longer till you start trying to reverse aging with hormone therapy. But it's not a reason. As the quicker you deficiency is treated, the less damage will occur, the better it is for long-term purposes. In some of those oral secretagogues, they claim also that there's growth hormone in it. There's growth, but the amount of growth hormone in a bottle that you take orally is on the average 4,000 times less than what you need to produce every day. So it's very, very diluted. And so you need to drink something like 4,000 bottles a day to correct the deficiency that is Foley, for example. You must be very thirsty for that. So, growth hormone treatment results. In 1 month time, you increase the IGF-1 levels, which shows that there's growth hormone activity at a sort of stable level. So you need at least 1 month time before you repeat the test of IGF-1. So we saw this person that was growth hormone deficient. When you give the treatment, this is what occurs after 2 months of growth hormone and 4 months of testosterone. It's a combination of effect. This was one of my very first patients ever to get on growth hormone. That was in 1995 or 1994 even. And you see here the change. The droopy eyelids, half droopy, and the hair is much better. And the sagging cheeks with this nasolabial fold. Nasolabial fold has disappeared. Here he was tired all the time, and here was not tired anymore. So you see this sort of change that occurs with treatment quite quickly in those who have enough male hormones, that's a condition, and are able to make enough IGF-1 from the growth hormone. And that's not all people. You can know beforehand what's going to happen by looking at your patient. If the patient has severe muscle wasting with a triceps that is hanging, that's very thin skin. That's typical for a person who cannot absorb amino acids. And you will see in the lab test a low proteins. And so we'll later, but that's another topic, a very small addition of a very long-acting insulin will improve amino acid absorption, not only from the intestines and blood, but from the blood and the muscle cells and the skin cells. So you see here this deeply wrinkled face that the patients were complaining. My first group of patients, 48 adult patients that I treated, and was published 1997. And you see that the growth hormone drastically reduced or improved the deeply wrinkled face. Patients said they felt better. Only a quarter of the patients who were treated did not find any difference. Eyelid ptosis, the droopy eyelids, in 2/3 of patients who were taking that treatment for 2 or 4 months, it improved. The sagging cheeks decreased. The loosey skin folds under the skin also improved. It gives a facelifting. Now we inject locally when we don't improve enough with growth hormone and IGF-1. We inject locally the hormones, and we see this effect, sometimes spectacular, by mesotherapy. So you concentrate the growth hormone there, and it does work. And one session is enough to, after a month, you have a real rejuvenation, and you might have to repeat 2 or 3 times, but at least you will see a visible result after 1 month. It's the same for aging faces that does not improve enough with systemic growth hormone. You put it in, you concentrate some locally in a session. So we saw this person with an aging body, and actually this person looked like this 2 or 3 years before, but they took out a tumor in the pituitary gland, and they gave him all the hormones he was missing except growth hormone. And that's the result. Without growth hormone, thyroid hormones cannot improve it, sex hormone cannot improve it. This patient got sex hormones and thyroid hormones and adrenal hormones, and he still had this body aspect because growth hormone is essential. So in 2 or 3 years' time, you can tremendously age with a lower growth hormone. We are the pioneers in growth hormone treatment and anti-aging treatment that I would even call reversing aging treatment. So you yourself, you should be, if you have a deficiency in growth hormone, treat it with growth hormone, because you'll look better anyway, you'll feel better, and you'll live a little longer with this. It's just not acceptable, I think, if you really want to be an expert, not to take yourself growth hormone. It's one of the basic treatments. At my office, we're working with more than 25 different hormones. We're, let's say, much further than that, and it's even for my, I would say, the other doctors who work with me. I have 7 doctors working with me. It seems unbelievable. Somebody's hesitating about growth hormone. There's already so much data that is reassuring about the effects. This is a person with obesity, and this is her after 2 years of growth hormone treatment. What a difference, no? Of course, the doses of growth hormone were much higher in this patient, so you get this efficacy with growth hormone alone. And there is in massive obesity, as she was before, a growth hormone resistance, so you need to give much higher doses to get this effect. But you understand that this person, in a certain sense, in her body composition, has rejuvenated. So this is the fat you have in growth hormone deficiency. It accumulates in the belly, inside of the abdomen. You see here, all this black is fat. This is fat here. This is fat on the back. Too much fat everywhere. And this is after 6 months of treatment on high doses. Maybe too high, but not in this patient because it reversed. You see the fat here is much reduced, but there's no fat anymore here, almost no fat, and no fat in the abdomen. So we know that there's more cancer and hypertension when you have visceral fat, but this fat mass decreased drastically. You see here the fat and lean mass. There's, with growth hormone in about half a year treatment, you had, on relatively high doses, the fat was decreased by 6 kilos, and the lean mass was increased by 2 kilos, and the rest was more water. So it's a more juvenile body composition. But we can go much further now, because we have also IGF-1 we can add, and that amplifies this effect of growth hormone. There's a difference between the typical growth hormone effects and IGF-1. IGF-1 is the hormone that thickens the skin and thickens the muscles. Growth hormone can work with IGF-1, but alone, when the person is not able to IGF-1, is still, growth hormone can still decrease fat mass and much more than IGF-1, and make the skin more elastic and more firmer and thicker. So you see here the skin reversal of skin atrophy with growth hormone. There's an increase of the skin in very elderly adults who did not receive other hormones than growth hormone. But when you add other hormones, the effect is better. You get about 20%, 23% increased thickness of the skin. So this person had a lot of psychic in my study of my in 1997 that I published on growth hormone deficient patients, we saw that the growth hormone drastically reduced the permanent fatigue, drastically reduced the easy exhaustion after physical activity. The low resistance to staying up after midnight was drastically improved. Almost no patient did not improve. Depression, much better. 5/6 of the patients improved. And being low self-esteem also improved. And they were more aggressive in a positive way, that they could put their limits in the front of others. Also, these excessive emotional reactions were much decreased. It makes you really calmer. You do not overreact easily when you have enough growth hormone. You have sharp-willed withdrawals, tendency to social isolation was much decreased, sense of powerlessness much decreased. You are able to do much more. When I started with growth hormone, actually I became quite quickly the president of many organizations, including international organizations, because I was first, I could do much more work than the others. When they slept, I could work. I didn't need much sleep. 5 hours was enough. And I could stay calm, and I could find solutions quicker. So that's much better for somebody who has to be the boss in a healthy way, not the small. Testosterone is a hormone that gives you also a bossy feeling, but you're the small boss. You want to crush other people. That's not with growth hormone. You want them to be good, and you feel good, and you irradiate a calmness. So when you give only testosterone to men, you have to watch out. Because that man will be proud of himself, of course, but he will consider himself as the best. If he has a growth hormone deficiency, that's how he will react, and he will be too bossy at home. And he will crush other people at work. And that doesn't work on the long term anyway. So never supply testosterone in relatively high doses to a man who's also quite severely growth hormone deficient, or he will be more aggressive. Growth hormone calms down this excessive aggressiveness. Of course you're more intelligent when you're growth hormone, but you realize that the other person doesn't need to know that. If you're more intelligent with testosterone, you will always say, I'm the best, I'm the most beautiful, and you look at me all the time. So growth hormone is safer on that side. So you see here the sleep, the total sleep is decreased with growth hormone, but nevertheless it's much more a recovery sleep. You see that the deep sleep is increased in time, but also in intensity, and the rapid eye movement sleep is also improved. And those are the most important parts of the sleep. You recover much better then. Also for memory is better. So, are there any real dangers of growth hormone treatment? Can you suppress the endogenous secretion? There's no proof. There's no study that shows actually. There's a small study shows a transient decrease at high doses of growth hormone. But generally, when you give physiological dose, you don't seem to suppress. And my impression in me and several of my patients is that it rejuvenated the pituitary gland so it could secrete more growth hormone. And so I had to decrease the dose all the time. I started on 1 international unit, or 0.33 milligrams, and then I had to decrease more and more because I got swollen up, onto the dose of 0.05 milligrams a day, which is my dose actually. I did increase a little bit more, so I'm probably more around the it's not 0.05, it's 0.005 to 0.01 milligram, which is very small compared to the 0.1 milligram I usually give. I usually take 10 to 20 times less than my other patients, but if I take more, I get swollen hands, swollen feet, and I absolutely do not want to have a long nose. It's already long enough. Acromegaly is not so beautiful. So, physiological doses of growth hormone. On growth hormone, there's no change. This one of the studies shows you. And pre and post-treatment growth hormone secreted profiles were comparable. So, you have studies. You have 2 or 3 studies that have investigated. Also, you see here, this is the study. This shows a mild and temporary lower growth hormone response to GRF and on pharmacological dose of growth. So you need to overdose 1 or 2 or 3 milligrams on an adult. It's not an overdose for a growing child, but it's an overdose for an adult. But not on the physiological dose that is the best and where patients feel comfortable. Is there diabetes with growth hormone treatment? There's no proof at physiological dose taken more than 12 months. Apparently it's mildly protective. What growth hormone does is that the first 6 months, if you have patients who has pre-diabetes and diabetes, you can increase the sugar levels and insulin levels. But after a year time, the fat mass has decreased, the muscles have increased, and other lean mass, and actually you have a greater insulin sensitivity, so you are less insulin resistant. You see here, this is a study that shows you that in the beginning, the sugar levels increase, and then they decrease on the growth hormone treatment at the month 6. But month 1, there can be an increase. So you have to start on lower doses in patients with diabetes. So you see here that the insulin-mediated glucose uptake was decreased in the beginning and then increased after. So things came in order after 6 months of treatment. We know that the growth hormone decreases the poor body composition in AIDS patients. You see the fat has decreased here, and fat here also decreased, and here also. It's not yet perfect, but it does. And that is the reason why there's less insulin resistance after a certain while of growth hormone treatment. Also, it seems that when you give, you increase the levels of growth hormone to levels of diabetics that to physiological, you do not increase the insulin requirements in well-controlled patients with insulin-dependent diabetes. Although in other studies, apparently you might have to increase slightly your insulin doses in the beginning at least. So there were higher insulin requirements the first 6 months, but there was a better control of hypoglycemic attacks. You know, one of the problems with those insulin treatments is that the blood sugar level sometimes drops too low. And there are 2 hormones that can prevent that. Cortisol in physiological doses and growth hormone in physiological doses. They are hypoglycemic hormones. They're the best hormones actually to prevent hypoglycemic attacks. So you see that after 6 months there was an increase in insulin requirements in this study in patients who probably had greater deficiency. What about heart disease? There's no proof at physiological doses. They're apparently moderately protective. So you see, this is a study I did in my patients, and it's not only with growth hormone. I did all the patients who came to my consultation in 2005, and half of them were on growth hormone treatment. And I studied all of them. I wanted to know if there was a cancer risk. There was a lower cancer risk, and about 30% lower. Overall cancer, breast cancers, and prostate cancer were about 30% lower. But what was interesting is there was also a lower arterial hypertension rate. The expected one for compared to U.S. women, for example, there was 50% decrease, and coronary heart disease was 34% decrease. So there was a major decrease in cardiovascular, new cardiovascular disease in these patients who were on the average treated for 6 years and a half. And you see that serum cholesterol is also decreased, total LDL cholesterol. And very interesting, it reverses atherosclerosis all over the body. The marker of atherosclerosis all over the body, you can check that easily by taking a Doppler, an ultrasound of the coronary artery, of the carotid arteries. And what you see is that you measure the intima media thickness, the inner wall of the carotid arteries, and you see that it's thicker when there's growth hormone deficient, at least in severe growth hormone deficient. And when 6 months of growth hormone have decreased. I have one of my students in Thailand who has does this in her patients, and she measured the intima media thickness before growth hormone and after. And she has many patients where it also decreased like this, and those patients were not so severely affected with growth hormone deficiency. But it works also in our typical patients. In childhood onset growth hormone deficiency, at rest the cardiac output is less. The heart pumps less blood at each contraction. And when you give growth hormone, you recover that. Also after exercise, there's a recovery. Cancer. Is there more cancer with growth hormone treatment? There's no proof at physiological doses taken 1 to 12 years. We saw this lecture, this very good lecture of Professor Abraham Morgenthaler on testosterone. It's about the same with growth hormone. Growth hormone does, in some mice species, increase the cancer incidence, but it does not then decrease the mortality generally in them. There's an improvement of survival, but there's more cancer. But there are studies where growth hormone decreases the cancer in some other mice species. But in big animals, it seems to be the opposite. Growth hormone seems to be protective, especially in humans. You see here in the study I did, the cancer incidence was decreased. Also prostate cancer and breast cancer.
Excuse me, Thierry. Yeah. I want to be the leader, but I don't want to put anybody down.
No.
And I've learned that from you.
Yeah.
Okay, but we're near the end to get in the other presentations.
No, it's okay.
Stuff. Okay.
Yeah. So I'll finish up first. Okay. But I think it's almost he had stopped the cough hour.
I know, they told me. Okay.
Well, I'll make it short.
Guys. It's good stuff.
Okay. Just to show you cervical cancer. If you have a low IGF-1 as a woman, your risk of cervical cancer is 2.5 to 5 times increased. Also for prelatent forms. And you see here for breast cancer tumor tissue, for example, women with the breast cancer tumors have about 61% to 72% or something like 30% less receptors. That means that they are resistant to IGF-1, and that higher IGF-1 levels that we found in breast cancer are actually due to is actually a marker of growth hormone resistance, not that it causes cancer. You see that prostate cancer is there's about 2 times more risk in this study if you're at the lower quartile levels. You're also 3 times more risk. So actually there are many studies that show it's protective. There's only studies with breast cancer and high IGF-1 levels that are not so reassuring. But there's enough explanations to not be afraid at physiological doses of growth hormone. Premature death, there's no proof. You see that the decrease in lifespan, people who have a total growth hormone deficiency is about 19 in men to 34 years less life. Shorter life if you don't have growth hormone. You see also that the mortality is much increased in growth hormone deficient patients and normalized when they are on growth hormone therapy. This is the major hormone to keep you alive on the long term. Alcohol is not good. It decreases serum growth hormone. Caffeine also decreases growth hormone. So don't drink coffee and certainly don't drink alcohol every day, or you will be growth hormone deficient. And if you take a growth hormone treatment, it will not work. Even half a glass a day is too much. So keep it for the weekends, but 5 days a week, no growth hormone. How to boost the treatment? High protein intake increases IGF-1 levels. So eat fish, eat chicken, eat meat. Also, if you eat more, you have more IGF-1 levels. So this is on growth hormone, and I'm going to let Ron Rothenberg. Sorry that I was a bit, don't think over time, but everybody has started a bit late today. Thank you.